Brenda Charles will moderate the session, and Brenda is one of our lead nurses up on our unit, which is, I guess, will be renamed now, not heart failure, right? It's going to be heart dysfunction or whatever we come up with. But Brenda, please come on and introduce the panel, and we'll get started.
Well, it's afternoon, so good afternoon, everyone. Again, I'm Brenda Charles. I'm a clinical nurse specialist in heart failure here at Houston Methodist Hospital. And I recognize so many of you who are here today, and I'm just so happy that you came out today. So I'm going to begin with asking the panel of those who will be presenting to come up here and have a seat at the panel table. So as our participants come up to the table, I believe we have a video presentation that we will begin with.
I've accepted the diagnosis. I've accepted the changes that I've had to make. And luckily so far I'm in the early stages. So the lifestyle changes have been more so diet, so reducing, paying attention to salt intake, paying attention to excess fluid intake. Exercise-wise, I've sort of changed my goal with exercise. Before it was just to go out and just do as much as I can and just compete and do different things. Now it's more for enjoyment, it's for health, and it's for maintaining my ability to do the things that I really like to do.
I'm very, very diligent about following what the team wants me to do. You just monitor my weight because of fluid. I do that on a daily basis. And communicate with your team. The other thing is to really keep a good record of your blood pressure. Even if it's just writing it down, and blood pressure, the date and the time, because it helps them when you bring that log in to see exactly what's happening. And I also add notes to that say, okay, this is where I increase the medicine they told me to do, or this is where they told me to decrease or stop or whatever, so that they can see absolutely what's going on in your home, because it's very different when you show up and get your blood pressure here. I know mine goes up tremendously. So
I pay attention to my symptoms. If I feel a little fatigued certain days, I may refrain from doing excess activity and maybe plan them out, pace myself a little bit better. But in general, overall, I just try to live a very similar life as to what I had before.
We call this our new normal. I have heart failure. It doesn't seem to be going away. I just have to deal with it. As far as normal routine, before children, I worked, I commuted. I'm a stay-at-home mom now, and that's my new normal. So it's hard to separate the heart failure and the pregnancy because it basically happened at the same time. So I know my life would be different anyway because I have children now.
It's just part of my habit now. It's just what my blood pressure cuff and my notes are right there next to each other. I have a wrist cuff and I take it, and it's very, very, very doable, and it's really part of my routine. I take other medications anyway. I mean, when you're this age, you're taking, whatever, Premarin or something else. So it's just another part of the routine added in. I talk a lot to my fiance about it, and just once I have these, and it usually happens right before the test, that I have this kind of like, oh my God, what's it going to turn out to be? And it's the same thing with the checkups for cancer. I mean, oh my God, what's it going to turn out to be? And it's not like you're negative. It's just that that's a realistic part of what goes through your brain. And then once it's done, you're okay. So the resources here are wonderful, having the team, certainly having the medications and being flexible in those medications now. A lot more medications and things to manage heart failure than there were many years ago when my grandparents were in heart failure. And I think that's a lot of times what people remember. They remember years ago in heart failure. Heart failure is managed very differently now, and it is manageable.
Well, I think the key thing is really to have faith and perseverance with this disease. I know this is something I'm gonna live for the rest of my life with. It's chronic. I know there's gonna be some days that are better than others. And I think it's all about keeping things in perspective. And I think the people who are around me, my loved ones and friends, that they understand the perspective that I'm coming from. every day on this earth is a gift for everyone. And so I realize that and cherish that even more so with this. And that's just pretty much the tenets that I live by right now. And I just really try to do the best I can to live the healthiest life that's possible.
Okay, so what I would like to speak with you about is discharging from the hospital. And that topic will also be shared with me because I'm on the inpatient side, but from the inpatient side, you then are discharged to home, and we have our heart failure clinic here, and the nurse practitioners who will see you in the heart failure clinic, as well as the physicians. Susan Bionat will speak along the same lines of the information of optimizing your healthcare experience, and I'll speak from the inpatient side. So heart failure definitely can be managed upon discharge from the hospital by following some important steps. And we begin at the time of admission and speaking with you about these important steps. As a matter of fact, if you've been in hospitals most recently, we may even list these steps on something called the whiteboard in your patient room, so the information is facing you daily as we come and speak with you about that. And when I say we, I'm speaking about your entire care team, nurses, physicians, registered dietitians, nurse practitioner, etc. Treatment may vary from person to person. However, these are some general guidelines, and these guidelines are credentialed American Heart Association, Heart Failure Society of America, ACC, some physician organizations, etc. And they're developed to make you feel better and stay out of the hospital longer. So what do those look like? Of course, you just had your diet. I hope lunch was delicious. Salt. We're going to start with a low sodium diet. And the low sodium diet will be mentioned, definitely more to come on that, but we give you a budget. That budget is 2,000 milligrams of sodium. So you need to know, how much sodium is that approximately? Well, in 1 teaspoon is 2,300 milligrams of sodium, which is salt, and the registered dietitian will be speaking to you a little bit more about that, as well as our chef. So do not add salt to your food. You'll hear that theme throughout. Fluid restriction. So what is fluid? Water, popsicles, Jell-O, ice cream, pudding, the yogurt you may have had this morning. What did you have even before lunch? Did you have coffee? Did you have orange juice? We had a variety of things. Did you have water? What did you already have? The physicians will generally ask you to limit your fluid intake somewhere about 6 to 9 cups within a 24-hour period. That's an entire day. That's about 1.5 to 2 liters per day. So if you had a 2-liter bottle of Coca-Cola or whatever, that's about 9 cups of water inside there, or 9 cups of fluid, and all of these foods are included. Then we'll talk about your activity when we're preparing you for discharge. You will do some physical activity every day in the hospital as you prepare for discharge, and that's something you will continue to do. Some will have physical therapy that is ordered, and that's more to come, and the exercises that you will work with your physical therapist, and that help keep your heart and your lungs very strong, moving in the right direction. You will get tired, and as you get tired, rest. Take a nap. If your sleep pattern at night is not the best sleep pattern, then take a nap and rest during the daytime. Rest definitely can lower your stress. Then every morning at 4 o'clock in the morning, somewhere between 4 and 5 o'clock, we will wake you up. No, just tease. Hopefully not. But early in the morning, after you empty your bladder and before you eat your breakfast, you will be weighed. And we will teach you how to weigh yourself. It's something you will do at home. You will keep a log at home and write it down. And when you visit your care practitioners, bring that log in with you. They want to look at your weight monitoring. Why? Because if you build up fluid and you gain 3 pounds in a day, or generally we say 6 pounds in 3 days, and it doesn't have to be in that order. 1 pound this day, 2 pounds the next day, 3 pounds the next day, you are progressively gaining fluid. And as that happens, we want you to call your doctor. So you're holding that extra fluid in your body, and that is not good for the heart. If we catch the fluid buildup early, we can keep you out of trouble. And I'm sure Dr. Bhimaraj would agree, it's much easier to keep you out of trouble than it is to get you out of trouble. Your medications. Generally, we will ask you to faithfully take your medications every day. So you'll have a combination of medications that will be prescribed, and you take those every day because you want to feel better, you want to do better, and you want to live longer. More to come on the medications from the clinic side as well. Symptoms. Symptoms have been discussed earlier today. However, when do you want to call your doctor? Increased shortness of breath. So sometimes you're short of breath when you do specific activities, etc. But if you find you're increased in that shortness of breath, do call your doctor. You're propping yourself up on pillows more than usual. You've added an extra pillow. If you're gasping for breath when you wake up, or again, the weight is so important. Look at your log. If you're gaining that 3 pounds in a day or 6 pounds in 3 days, definitely you will be calling your doctor about these symptoms. And there's more to come on the symptoms as well. When you're in the clinic, they'll speak to you about these as well. So smoking. I know, it's really difficult. Quitting is one of the best things you can do for heart failure. One puff will constrict your arteries, and your arteries definitely is what's carrying your blood flow, right? So if you're constricting blood flow, that is adding to the damaging of your heart as well as other organs. Smoking puts a strain on your heart and it makes it work harder. Smoking decreases oxygen in your blood. Smoking raises your chance of a deadly heart attack a lot. And smoking raises your blood pressure. So tell your doctor if you don't think you can quit on your own. Your doctor, your care practitioners, they understand and they can help you. Specifically, some people think, I can just go get the nicotine patch off the counter. You don't want to do that without speaking with your physician. So definitely talk with your doctor about that. Your follow-up appointments will be definitely given at discharge. However, you will have some clinic information that the nurse practitioner will share with you as well on follow-up appointments and how important it is to not only keep your appointments, but there are guidelines now about physician appointments and heart failure. Those are important to monitor, and adjustments can be made in your medications, your care treatments. Therefore, you definitely want to keep your appointments. Make a calendar, put it on there, doctor appointment. More to come about this. I'm not going to take questions at this time. However, you have everything in front of you to text the question, which I think is a great way to do this, but we'll move on to our next speaker. So our next speaker will be Susan Bionat. Susan is an acute care nurse practitioner in our heart failure clinic here at Houston Methodist Hospital.
Good afternoon. My name is Susan Bionat, and I'm one of the nurse practitioners for the heart failure disease management in here. And what I would like to really emphasize at this point is just more of the outpatient and optimizing your healthcare experience in the outpatient setting. And very importantly is that when you get discharged from the hospital, is you get a 7-day post-discharge clinic appointment. Not only that is get with the guidelines with American Heart, but it's endorsed by the American Heart as well as a lot of the accreditation bodies that accredits us. So the 7-day post-discharge clinic not only will reduce the 30-day readmissions, but as well as reduce mortality, and as evidenced by the studies and literatures. Okay, in order to prepare yourself for the short visit that you will have with your physician, which is like to some 15 to 30 minutes a visit, these are the few things that gotta keep in mind, and as has been discussed this morning from various speakers, keep a log of your symptoms. And then also in this activity in here, we look at the functional activity, what you can do at home when you do your chores, when you do from simple activity of daily living. So in here, we assess how much you can do. And that's what we call the functional class, where sometimes you would hear that, New York Heart class 1 to 4, okay? So Medication reconciliation, very important that you have either the list of the medications prescribed to you that came from us through our discharge summary, as well as bring your medications, if you will, so that we can look at it during the clinic visit and reconcile it with what you have in the record. And this will prevent omissions and errors, and then sometimes duplication of the medication, and we can correct it during the clinic visit. We would like to also see a record of your blood pressure, the heart rate, and the weight, because in here we look at trends. From the time you were discharged from the hospital, keep a record, and then come to the doctor's visit. It will give us a good trend, and then we can make adjustment of your medications. And then during clinic visit, we also look at your adherence to the medications, to the diet, to the fluid, and so forth. And if there is anything that we can do to address those during the clinic visit and maybe do a more focused heart failure education. And then we kind of mentioned also, this is the point that you would address some of the other needs that you might have, comfort, and other, if you don't have any appointment, at this visit too, is we can help arrange the future appointments, and if you need medication refills and other collaboration with other of the multidisciplinary team, such as home health, physical therapists, and so forth in the outpatient setting. And this is also the point to discuss some of the questions and concerns and feelings that you might have during the clinic appointment. So with that being said, that's my portion of optimizing that 15 to 30-minute clinic visit. And in here also at Houston Methodist, we have the Heart Failure Disease Management Clinic. Should you go home and you don't have an appointment from your physician, whether it's a cardiologist or your home health or your primary care physicians, then we have this Home Heart Failure Disease Management Clinic, and this is the contact number. Thank you so much.